I present this case with a lot of humbleness, astonishment, and a lot of grace. As you can see, tooth number 30, the core is very close to the distal canal, quite a significant apical lesion on both mesial and distal roots. When we go into the cone beam, again, you can see quite a bit of bone loss. Now, here is the mesial root in the coronal direction. There is a clear mesiobuccal and mesiolingual canal. They do join and create a common canal apically. Now, I want to be very clear. I could not find that mesiobuccal canal. Here's the distal. You can see that core is close to the distal filling, but when you look at different angles, you can see that it did not actually cover it, which was fortunate. Now, I worked very diligently. You can see there's a mesiobuccal and mesiolingual canal up in the coronal third. I could not locate the mesiobuccal. I worked very hard and diligently. I tried to use all my spatial orientation, law of symmetry. I could not find that mesiobuccal. But here's the thing. Sometimes we can be astonished by technology and recognize the grace it provides. So I never found the mesiobuccal canal. Now, at one point, I did stop looking because I have had the instance in many cases. You can see here on the mesial, both mesiobuccal and mesiolingual are filled. There's two canals there. So what happened here? Well, what happened is I actually was able to accomplish something called what I like to call non-surgical retrograde cleaning and sealing. So with the laser technology, there is the potential to clean upwards. Here's the distal, and you can see that. But when we took a look at the mesial, what you're going to see is mesiobuccal and mesiolingual have sealer in them. I never located mesiobuccal. So the laser, I'm using the YSGG with the Edge Pro laser, was able to retro clean with irrigation and all the activity that happens under the laser. And then ultimately sealer was able to also retrofill that mesiobuccal canal. So I actually was able to accomplish full root canal treatment even though I never located the MB canal from the coronal. So this is where the astonishment of technology is. And you can see here where I had been searching and probably needed to go a bit more mesiobuccal to find that mesiobuccal canal, but you'll see sealer in it right away up in the coronal third. So the reality is I'm humbled because I couldn't find the mesiobuccal even though I looked so hard. But because I've been astonished before, I recognize based on the anatomy the potential that the laser would actually retro clean and then allow sealer to flow up in that direction. And then I appreciate the grace. The technology allowed me to complete this case without blowing out the coronal third to try to find that mesiobuccal. Now, there's a ton of sealer out the end. That's a whole nother video, but I wanted to share with you humbleness, astonishment, and grace at what we're able to accomplish. You can see that retro, clean, and fill.